After the primary assessment, you'll perform an in-depth secondary assessment. In addition to providing a thorough physical examination, a healthcare provider with pediatric advanced life support training should gather additional information about the patient and the incident that resulted in the need for medical care. Caregivers, primarily parents, other family members, and babysitters will generally provide most of the information. The sample mnemonic provides a memory aid to help you recall important medical information necessary to provide you the best care for your young patients. These topics include signs and symptoms, allergies, medications, past medical history, last meal, and the events leading to the injury or illness.
The sample mnemonic is really helpful because it helps you gather information about a sick child in a systematic manner. S stands for signs and symptoms. A sign is an observation that you, as a healthcare provider, make when assessing a patient, like the patient is wheezing. Examples of these signs include tachypnea, tachycardia, or diaphoresis. A symptom is a problem or complaint that the patient or the patient's caregiver reports to you, such as shortness of breath, abdominal pain, decreased appetite, or headache.
The next thing you want to do is ask about allergies. Are there any known medication and food allergies? What are the associated reactions? Food allergies may affect a child's care. After allergies, ask about medications, including over-the-counter meds, vitamins, herbal supplements. The patient's medications can provide important clues to his or her past medical history and current presentation. If there's a possibility that the child's symptoms are the result of a drug overdose, it is important to ask the caregiver what medications can be found in the child's living environment.
Once you know the child's medications, obtain the past medical history. That includes the child's previous illnesses, hospitalizations, surgeries, and immunizations. Past medical history can often provide insight to the child's current clinical presentation. For instance, a history of coughing at night may suggest asthma as a possible reason for a child's current trouble breathing.
But once you know the medical history, ask about the child's last meal. Knowing when and what the child last ate or drank is important. In cases such as anaphylactic shock, what the child ingested may be the actual cause of the condition. The time that has elapsed between the last meal and presentation of current illness can often dictate treatment and management of the condition. Pediatric emergencies sometimes require surgery, in which case the surgical or anesthesia team will want to know when and what the child last ate or drank.
The final component in the sample review is events, the events leading up to the current presentation. Healthcare providers should obtain an accurate timeline for all signs, symptoms, and events leading up to the current presentation.